What is a biosecurity audit? Biosecurity refers to the set of measures and protocols aimed at preventing the introduction and spread of diseases such as high pathogenic avian influenza among poultry by using procedures like isolation, sanitation, and documentation. A biosecurity audit is a structured and methodical assessment of a poultry farm's biosecurity measures designed to identify gaps, vulnerabilities, and potential areas of improvement in the farm's biosecurity plan. Why is a biosecurity audit important for poultry producers? By implementing effective biosecurity measures, farms can help minimize the risk of highly pathogenic avian influenza outbreaks. To be eligible for indemnity in the event of a HPAI outbreak, what is the definition of commercial poultry producer? Commercial poultry producer is defined as having a minimum annual production of 100,000 broilers, 30,000 turkeys, 75,000 table eggs, or 25,000 game birds. Who performs the biosecurity audit? Maryland Department of Agriculture, MDA, the official state agent, OSA, of the NPIP, conducts the biennial biosecurity audits. Field veterinarians from the MDA review the biosecurity plans periodically at the company level and check if the plans are implemented by individual producers or not. It is advisable but not customary for small farmers to have their biosecurity plan reviewed by your flock veterinarian or an industry representative every 6 months. How to create an effective biosecurity plan for NPIP audit? It should follow a general 14-point guideline set by the National Poultry Improvement Plan, NPIP, as described. The biosecurity practice should be well documented. Paperwork-only audits, without any site inspection, can be conducted by producers to be familiar with the audit process. The 14 elements of the biosecurity principles as suggested by the NPIP are: delineation of biosecurity responsibility, training of the farm owners and caretakers, reporting of elevated mortality and morbidity, provision of line of separation, restricted access to wild birds, rodents, and insects, mortality disposal plan, personnel, vehicles and equipment, auditing, perimeter area buffer, replacement poultry, manure and litter management, water supply plan, feed management plan. Now, we will go through different biosecurity principles as suggested by the NPIP. The first one is biosecurity responsibility. The biosecurity coordinator is responsible for the development, implementation, and maintenance of the biosecurity program. The biosecurity coordinator and other personnel in the farm are responsible for the implementation of the biosecurity program. The coordinator should review the biosecurity program at least once during each calendar year and make revisions as necessary. 2. Training. The biosecurity program should include training materials. All poultry owners and caretakers who regularly enter the perimeter buffer area, PBA, must complete this training. The training must be done at least once per calendar year and documented. New poultry caretakers should be trained at hire. Training records should be retained. 3. Line of separation, or LOS. Line of separation is a functional line separating the poultry houses and poultry inside from exposure to potential disease sources. Generally, it is defined by the walls of the poultry building with practical deviations to account for entry points, structural aspects, or outside access areas. All the sites should have aerial maps with LOS illustrated and access points. Plans must state the procedure to be followed if anyone is crossing the LOS. There should be a clear demarcation and signage so that it is clear for people. 4. Perimeter buffer area, PBA. It is a functional zone surrounding the poultry houses or poultry growing area that separates them from areas unrelated to poultry production. It is comprised of the poultry houses and poultry raising areas as well as nearby structures of the poultry farm. 5. Personnel. The biosecurity plan should include provisions specifically addressing procedures and PPE requirements for site-dedicated personnel. The biosecurity plan should also have similar provisions for non-farm personnel. The plan should also specify procedures that all personnel having had recent contact with others should follow before re-entering the perimeter buffer area. 6. Wild birds, rodents, and insects. Poultry operations should have control measures to prevent contact with wild birds, their feces, and their feathers. Control programs for rodents, insects, and other animals should be in place and documented. 7. Equipment and vehicles. The biosecurity plan should have procedures for cleaning, disinfection, and secure use of equipment and vehicles. Vehicle access and traffic patterns should be defined in the site-specific biosecurity plan. 8. Disposal of mortality. Mortality should be collected daily, stored and disposed of in a manner that does not attract wild birds. It is recommended that dead bird disposal be on-site, if possible. Mortality disposal should be described in the biosecurity plan. 9. Manure and litter management. Manure and spent litter should be disposed of in a manner to prevent exposure of poultry to disease agents. On-site litter and manure storage should limit the attraction of wild birds, rodents, insects, and other animals. 10. Replacement poultry. Replacement poultry should be sourced from flocks reared with NPIP guidelines. They should be transported in equipment and vehicles that are regularly cleaned, disinfected, and inspected. Biosecurity protocols should in place for equipment and personnel involved in the transport of replacement poultry. 11. Water supply. The source of drinking water and water for evaporative cooling should be clearly defined. If surface water is being used, treatment methods must be documented, and if treatment of the water is not possible, risk analysis should be performed. 12. Feed and replacement litter. Feed and litter should be delivered and stored in a manner that limits exposure to and contamination by wild birds, rodents, and other animals. Feed spills within the PBA, outside of the LOS, should be cleaned up and disposed of in a timely fashion. 13. Reporting of elevated morbidity and mortality. Abnormally high mortality should be reported as required in the biosecurity plan. Appropriate actions should be taken to rule out reportable disease agents. 13. Reporting of elevated morbidity and mortality. Abnormally high mortality should be reported as required in the biosecurity plan. Appropriate actions should be taken to rule out reportable disease agents.